Now, you have your husband, he's in the room with you today,
Yeah.
but you also have a little one, and because of the COVID restrictions, she can't really see you in a way that I guess would be comfortable for her to see you, and you've never really been apart from her.
No, that's right. I'm her primary caregiver, and I'm the one who gets up with her every morning and puts her to bed every night. She's very used to me and very attached to me. And when we got admitted, I really wasn't expecting no visitation. I thought there'd be some sort of policy in place that allowed for long-term patients to see their families. Excuse or whatnot. The answer I keep getting is, "You're not the only one in this situation." And my response is always, "Exactly, which is why I'm fighting." That's not a reason for me to stop and shut up. It's just more reason for me to advocate for other people too.
Families who are experiencing long-term hospitalizations are being separated from each other by poorly thought out COVID-19 regulations in Canadian hospitals. Today is just one of those stories. But I am so pleased to tell you that today's comes with a very rare happy ending. Today's video starts off as a somewhat frustrating story about how broad, sweeping coronavirus restrictions are harming long-term healthcare patients and their families. But it comes with good news at the end about how a couple of citizens can change their own circumstances, not just for themselves, but for everybody else if they just continue to push back. First, let's start by meeting Natalie and her husband Jesse. The Huffmans are anxiously expecting their second child. It should be an exciting and happy time for the entire family, but Natalie's pregnancy is complicated, and the COVID regulations in the hospital are keeping her from her little girl. I interviewed Natalie and her husband Jesse via Skype in their hospital room at Calgary's Rockyview Hospital just before the September long weekend. Just watch. So, Natalie, you're at the Rockyview Hospital on bedrest. How did that happen?
I have a condition called invasive previa, and it puts me and baby at risk, at high risk for a bleed, which means I need to be close to a hospital. So they want me basically, like, the closer I am to my room, the better. So if they need to intervene and take the baby out via C-section, I'm here. So I'm 32 weeks pregnant, and we have scheduled a C-section for close to 36 weeks. So I'll be here on bed rest for about a month.
Now, you have your husband, he's in the room with you today, but you also have a little one. And because of the COVID restrictions, she can't really see you in a way that I guess would be comfortable for her to see you. And you've never really been apart from her.
No, that's right. I'm her primary caregiver, and I'm the one who gets up with her every morning and puts her to bed every night. She's very used to me and very attached to me. And when we got admitted, I really wasn't expecting no visitation. I thought there'd be some sort of policy in place that allowed for long-term patients to see their families. And they told me that basically any children under the age of 14 years old are just not allowed on hospital grounds whatsoever. So it just sank in immediately that I'm expected to be here for 4 weeks on bed rest without any contact with my 2-year-old child, which is stressful, to say the least, on me and on her. And like, I've argued the mental health components of, like, separating a child from their mother for that long, and I'm supposed to be relaxing and not stressing. And yeah, this is the last furthest thing from what I feel right now.
Now, I guess the next question is, what has this been like on your family? Because, I mean, you're the primary caregiver for her. You're pulled away from her. This is a scary situation already. And now mom's not, I can't even go see mom as far as your daughter's concerned. What's it been like for her?
It's been really sad. She hasn't been sleeping well at night, and she's been waking up in the morning crying, and we try to FaceTime, but she's 2, so she doesn't really grasp the concept. She sees me on the phone and it seems to actually upset her. She just kind of cries more, and it's definitely had an impact on her. And I recently sent her. My mom took her to my sister's, where she has her cousins there, and she's spending some time there. But I mean, it's 3 out of 25 days that she's kind of distracted right now. So I'm just trying to figure out how we're going to get through this.
And you said it's been stressful on you. What can you be a little more specific?
I mean, I would go ahead and say I have complete anxiety about it. I mean, I'm stressed about her feelings and how she's coping with it. I don't want any like detachment issues. I don't want anything like long term for her to like feel like she's abandoned by me. It's a horrible feeling. Like I say, 24 hours away from her, I'm running home. So this long just feels like it's just very stressful.
Now, you have actually reached out to the hospital and tried to find a way to accommodate your daughter coming to visit you to alleviate some of that separation anxiety for both of you. What one of the suggestions they gave you, you let me know, and I think it's pretty ridiculous. They said for you, who has to be near your room, like you have to be near your room, they said go outside somewhere by the road to see her.
Yeah, so which doesn't make any sense, which me and my husband have argued repeatedly. So they basically, in one breath, they tell me that like the closer I am to my room, if I had something happen, basically need to intervene within 10 minutes for baby to survive. So they want me as close as possible to the room, but rather than allowing her up with precautions, she's compliant with wearing a mask, whatever it is, they want me to be off hospital grounds to see her. So I'm expected to go down outside to the parking lot to visit her. And the Rockyview Hospital is a busy hospital. It's like the parking lot there's traffic. I mean, it's just not a safe place for me. Like I say, the further I am from my bed, the less safe I am. And it's not a safe place for my daughter to be either, playing on the road. Like she's not going to sit and have a coffee. Right. So it's just not really, to me, it just wasn't even really an option. Like that was just, yeah.
Now you are, I guess, kind of a problem solver because you saw something and you suggested it. You said there are private meditation rooms in the hospital that nobody seems to be using. Why can't you use them to see your little girl?
Yeah. So there's these private meditation rooms that have been locked due to COVID, just because normally people go in and out as they please, but with COVID, they do need to clean between each person. So they've just, rather than trying to manage that, they've just closed these rooms off. So I asked if they would be able to unlock one of the rooms while I'm here so that we could have like an enclosed private area where I could, snuggle her, watch a movie, and just have some time with her. And they declined. They just said that they have increased need for like cleaning right now with the COVID situation, and they just don't. It was just a no.
And so after that happened, is there like a patient's advocate that you've reached out to? What's going on there?
Yeah. So I reached out to this patient advocacy line, and she finally got back to me today. I've been here for almost a week now. And she said, and not just her, this has been repeated a couple of times, the excuse or whatnot, the answer I keep getting is, you're not the only one in this situation. And my response is always, exactly, which is why I'm fighting. That's not a reason for me to stop and shut up. It's just more reason for me to advocate for other people too. So she offered that I maybe rent an RV and park it in the parking lot outside, and I could go and bring my daughter in the RV to visit her privately out there.
But you have to, off hospital grounds, you have to be on hospital grounds because you have a precarious medical condition that puts your life in danger and your unborn child's life in danger. And they want you to rent an RV. I mean, this is one of the most ridiculous solutions I've ever heard.
I didn't really know how to respond to that. I just, I mean,
who even thinks of these things?
Yeah, no. At this point, I have looked into an RV because it's just like, if it's that's the only way I'm going to see her, then I don't know what else to do, because I feel like I've given reasonable, safe solutions, and I just keep getting these dead ends. And I don't feel like anyone's really looking at the situation on like a case by case basis. It's just these blanket statements and like red tape policies where it's just like a general no. And I've heard repeatedly as well, like if we say yes to you, we have to say yes to other people. And I've argued that they should be saying yes to other people. They should be looking at case by case, especially for long-term stays. And this whole supposed COVID situation is going to be around for a long time. So they need to be looking at like ways to work with people and their families to cope with it. Not just, sorry, it's COVID. This is it.
Right, and this is a hospital. So for them to say, "Oh, we have to clean something." Well, good, I hope so. I hope you're cleaning everything every time somebody touches it.
Yeah, I actually offered to clean the room myself. I could take alcohol and wipe the room down if you'd like. Like, that's not a problem.
Natalie, I'm going to rattle the cages at the hospital and see what sort of things that we can sort of whip up and make a little noise. And because you're not the only person in this situation, I think all of us know somebody who has been separated from their loved ones because they are receiving medical care. There are plenty of dads who can't see their baby's first ultrasound. They won't get to stand beside their wives and see their baby's heart beating. And maybe you're going to play an instrumental role in changing some of those policies so that families are involved in medical care instead of just the patient.
Well, that's what I hope for.
Now, normally this is the part of the story where I make a lot of trouble and noise for everybody involved, including myself. But I thought for once I would try a more diplomatic approach while Natalie continued to do the same thing on her end. I wrote an email to the health ministry on the Friday before the long weekend. I was looking for comment because it's pretty clear these coronavirus regulations are blanket regulations. They aren't really taking into account long-term healthcare patients and the stress being put on them and their families through constant separation. And at least at the time, all the avenues to have this problem fixed had been exhausted. It was my hope that no one had yet really recognized that this was really a problem, so I wanted to put it on someone's radar so that they could do the right thing and fix it. So this is what I wrote. My name is Sheila Gunn Reid. I'm an Alberta-based reporter with Rebel News, and I'm working on a story about long-term patients at Rockyview Hospital and the healthcare policies that make visits with their families difficult. Specifically, I was contacted by a mom who is in the hospital for the next 4 weeks on bedrest with a very high-risk pregnancy. Because the hospital policy does not permit visits from those under 14, she will be separated from her 2-year-old daughter for the next 28 days. They have never been apart before, and the mom is concerned about the stress to her pregnancy as well as the long-term consequences for her daughter because of the anxiety of the separation during such a frightening time. The mother in question is a nurse, so she knows the appropriate channels to seek some sort of remedy. Now then, in the email, I went on to re-explain everything that Natalie had suggested the hospital could do for her and everything that she had tried to do already. And then I wrote, without addressing this specific case, are there changes coming to COVID-19 policies to address the problems of family separation facing long-term patients in Alberta's hospitals? Thank you in advance for your time. My deadline to include the ministry's response in my story is Tuesday, September 8th, at 9 a.m. Mountain Standard Time, so just after the long weekend. Now, here's the part of the story where this all becomes a big win. After I interviewed Natalie and Jesse, and after I sent that email to the health ministry, Alberta Health and the Rockyview Hospital suddenly reversed course and allowed Natalie and Jesse to visit with their little girl privately in one of the unused meditation rooms, the exact way Natalie had initially suggested, and the exact way that the Rockyview Hospital had previously told them would be absolutely impossible. Now, here's what I think. I think my email and Natalie's persistence made the health ministry and Rockyview realize they were in for a huge problem and a big controversy on their hands because they were basically arbitrarily keeping a teeny tiny toddler away from her mommy in one of the scariest times in both of their lives. But I don't even really care what the reasons are because all that matters is that Natalie gets to see her little girl and her little girl gets to see her mom now. I reached out to Natalie because she and her husband They're the real heroes of the story here because they advocated for themselves until somebody listened to them. Here's what Natalie told me. I'm beside myself with how hard we had to fight to see her. We didn't back down, and I think a lot of women in my position would have just accepted the terms and the rules, which is so sad. I hope people keep fighting and raising awareness. Now, Rebel News. This is a weird story for me because I cover a lot of stories about how the government is unresponsive to an individual's needs. And that's definitely how this story started out, but that's not really how it finishes. So I guess hats off to the Rockyview Hospital and Alberta Health for changing their minds for Natalie and Jesse. And congratulations to Natalie and Jesse. I hope they inspire more long-term patients in this province to never take no for an answer when COVID regulations separate them from their loved ones. For Rebel News, I'm Sheila Gunn Reid. At Rebel News, it's our job to tell the other side of the story. However, we cannot do that without your help and without your support. Now, one of the best ways to support us doesn't actually cost you a dime. Just like and share our content. Make sure you're subscribed to our YouTube channel and ring the little bell so that you never miss a story. And do consider becoming a subscriber to Rebel News Plus. That's what we call our premium long-form TV style shows. Just go to rebelnews.com/subscribe to join today.